It's been such a phenomenal journey following all these people. But I think what we need to realize is those ones, especially now during the pandemic, that have put themselves in the front line and have given back so selflessly without having to think twice about their own lives. And today we're going to be speaking to, of course, we're celebrating International Nurses Day and the amazing work that nurses do for us around the world. And speaking to us today is Simon Hlungwani. He is the Democratic Nursing Organization of South Africa. A very good afternoon to you, sir. And thank you so much for joining us this afternoon.
Good afternoon, and thank you for having us. We greet the listeners as well.
I think we're very privileged to have people like yourselves on our show this afternoon. Firstly, before we even start off, from myself and the Salam Media team, we want to commend you, ode you, and celebrate all the nurses and all the frontline workers out there that have given back so selflessly in many directions as far as this pandemic is concerned. And I mean, they've, of course, put their own selves and their families at risk by going out to save just people like us every single day. So thank you so much. And we really commend you on it.
Thank you very much, and you are welcome. We appreciate the overwhelming support and appreciation that society in general, including the media, is giving to us during these difficult times.
I agree. The thing is, it's something that cannot be not looked at. I mean, if you look at the nurses, every single day that they get up, they're having to face being at risk as far as this pandemic is concerned. But nothing has stopped them for being so selfless to go out there to say there's lives that we need to save and there's people that we need to help that are in a situation.
Yes, certainly. Although we know that everyone is facing a risk, and including nurses, because they are not immune to the COVID-19. What we also know is that except the nurses' availability, what other options do we have in the country? Because as it were, we didn't have a vaccine, but even now that we have a vaccine, it's not yet scaled up to everybody. But nurses know that if they are not there to take care of the patients, then we know that we can have a catastrophic situation. But because we are professionals, we are trained, we have the know-how and the skills and the nursing science of how to take care of the patients, we then give ourselves giving ourselves to saving humanity, and we take care of the patients, those who've got coronavirus, and we face it on a daily basis. And we only do it because we think, if not us, then who else? But we know that in the meantime, some nurses, most nurses got coronavirus, turned positive, and some nurses have died. And we say there are nurses who died in the struggle of fighting the pandemic, and that should never go just never go down in the history unrecognized.
Most definitely. And I so agree with you. That's the whole idea. And this is the reason why we so here at Salam Media are also celebrating International Nurses Day, because we do understand what it is that they've been doing for us. And I think we wanted to also extend our appreciation for them going out every single day with their heads up high and wanting to go out there and make that difference by saving those lives.
Yeah, certainly, and we do appreciate that very much. And we're hoping that coming out of this, we will then draw lessons in order to assist our healthcare system in South Africa to be more resilient and more stronger. In that way, we are not going to have many casualties should we have another pandemic in some years to come, because we believe that, and we know that pandemics may not necessarily end now. But should we experience another health crisis in any form, we should be able to have a more resilient health system in South Africa so that we can be able to have less casualties and less people dying from that. Because currently in Africa, we are leading by the infection rate. We are also leading in the death rate when it comes to COVID-19. But the reason why we are saying resilient is that we need to build up all systems, including ability to have our own vaccines and develop our own vaccines, and ability to have, as you would remember, enough beds in ICU, enough critical machines to take care of people like the incubators and so on. Like currently, we had a problem where we had to even get donations from the US and so on. So when we say a resilient health system, what we mean is that all these rounded must be addressed, including the issue of shortage of nurses and other health professionals.
For sure, I agree with you there. Talk to us about the challenges that you faced in this environment. It's, I'm surely not easy. The reason I ask this question is I want all our listeners to understand why it is that we have to appreciate every single nurse that goes out there every single day.
Well, I think some might know that since the beginning of the pandemic in 2020, nurses have not had an opportunity, most of them, to take their leave as would have been planned. Last year they were told. In fact, it was a call for the nation and also for the profession to say, you can't go on leave because we have too many patients. All hospitals are full. That meant that they did not have their time to recuperate. And the exhaustion then set in when the second wave hit us in December, around there in January. So nurses were overwhelmed by the fact that they were not able to rest. Secondly, nurses did not receive their wage increase, which means the impact of coronavirus when it comes to the cost for transport, the cost for petrol, the cost for bread, the cost for even tomatoes at the current moment is increasing, including electricity that increased by 15%. It's eating up on the disposable income that we have, and as a result, we are strained, coupled with the fact that even within our own families, some have lost their jobs, and it will be siblings, it will be children, it will be parents. Now you have to stretch out your little income. And last year we did not have a danger allowance, we did not have an increase. Including this year, we are still struggling to get a deal with government where nurses would be paid their wage increase for this year. So there's a lot in that. Over and above that, there's a greater shortage of nurses in the country, which means one nurse is doing a job for four nurses, as it were. And it makes it difficult for nurses to be able to cope on daily basis with their workload. And we do know that there's also issues of resources such as the availability of PPEs, where it's curtailed. Sometimes you get told you can't have a N95 mask, or we don't have what we call the overknees, and so on. So these things, they create a fear among ourselves. We become fragile as nurses. But we do appreciate that at least the public can see that and they appreciate us. Despite all these challenges, there's one thing that we have guaranteed the community. We will never shy away from the responsibility, because even all those challenges that were there, even including at a time when we did not have PPEs, nurses were there to take care of the patients. They never shied away from their responsibilities.
I so agree with you there, and we've seen it in many directions in all the hospitals and all the makeshift hospitals. Also, as we know, there was one stage where we had to do that because the healthcare system couldn't deal with the amount of corona patients out there, and I'm sure it's very strenuous for one nurse to be able to look after four patients that are in a really dire situation. So we understand that particular constraint. What other sort of challenges have you faced going through this period?
Well, during this difficult time, also, I must mention that, especially during the first lockdown, there were incidences of abuse of nurses, wherein if nurses were using public transport, especially the public taxis, when nurses entered those public taxis, they were removed by fellow passengers who said, we don't want somebody who might be carrying a corona. So I know it's something that is bad, that the community may not realize that they are damaging our emotions during that period of time. But we also understand that it was created by a fear, because people didn't know what was the problem or how they can cope with the situation. But overall, I think in that fear, the greatest fear right now, although there's a solution, is that we have a problem where nurses are all awaiting to be vaccinated, those who are willing and are able to take the vaccine. Then they would know that they have a defense against the coronavirus. So even if they are facing the corona, they know that there is something that can defend their immune system, and they may not necessarily be casualties wherein they would get COVID-19 and end up dying overall, because there's so much stress. And also we have lack of support, where if you are stressed, there's nowhere you turn to get psychological support within the system. And those are just some of the things that are making us very, very fragile. But we do hope and pray that sometimes some of these things can be sorted out, because we know if they are sorted out, we'll then not have much greater problems going forward.
Most definitely. And what would you expect from the public and from government to be able to make your lives easier so that you can carry on and go ahead with the most important work that you have to do, which is saving lives?
Well, let's start from our own families. If they support us, and I must say we appreciate all families who have supported our nurses, because if they were not there for us, sometimes they prepare food for their mothers when they realize that the mother is coming back from work and tired. They make sure that they have happy, nice meal at home. At least you feel comforted and you enjoy the meal of the day. The support that is psychologically giving us, sometimes we feel like giving up. We appreciate our own families first. Secondly, the community. Keep up the good work of appreciating us. The only thing we want is for the community to listen to us when we say we must wear the mask, we must sanitize, all the regulations that are followed. We remember we enforce it and we say to people, follow. The second thing is that we want community to adhere, especially those who are clients or patients, to adhere to the treatment protocol. If we say you must take your medication in this particular way, you must do so. And in cases where you need to ask questions, feel free to ask us. We appreciate all that, and that's what's going to give us a healthy nation. But in terms of government, we want government to address the challenges that we have. That includes the issues of dealing with our remuneration, dealing with the issue of shortage of nurses. We have community health, community nurses who have completed the 5-year program. It's a 4 year degree or diploma and a 1-year community service that they have done. Some of them are staying at home, they are unemployed. We are calling upon government to urgently appoint them, and those who have been given short-term contracts, the 3 months, 6 months, or 1-year contracts, they must be employed permanently, because we will continuously want them. But over and above that, we want government to work out a strategy of how to deal with the challenges that we are having, because currently, because the focus is on COVID, there is a reduction in the services for chronic treatment, for chronic treatment that includes your high blood, your diabetes. There is also a reduction in the services for TB treatment. There's a reduction for the services of immunization of children. And this has been revealed by the International Council of Nurses report, which was released today. So we're saying if we do not, as a country, address those issues, we will then deal with COVID-19, we defeat it, but we have more other greater problems that are still going to render our society unhealthy, and a lot of problems are going to incur, and our health system is going to be overwhelmed again, which is what we're saying. The government must address all these issues, including the shortage of nurses, which is what must be addressed, and the remuneration and the others. Overall, we are even available to engage and advise on what must happen further than that with government.
I agree with you there, because it's having to be able to bridge that gap for you, so that you can, as you were saying, I mean, if you're short of nurses, it's a very huge problem at this point in time. So having to integrate those ones that are already, as you said, ready to get into the system, it's going to, of course, ease it up for the other nurses, and there's going to be more efficient help out there as far as that is concerned. So I totally agree with you there. I think that's something that they really need to look at. Also, I think what's important is that from the community point of views, it's nice to see that the communities have tried to also do their share of trying to help the nurses out in some way or the other by supporting them, by giving them that support structure in the form of appreciation, firstly, and secondly, by saying that if there's anything that they require, they are going to, I mean, a lot of NPOs and organizations had come together to be able to, give you those PPEs that you required, and those masks and things that you ran short of during that period.
Yes, certainly. Some communities, a lot of them, we must appreciate, they've mobilized for resources. And some of them, they were just bringing sanitizers for nurses to use when they they are on their way home. And I do know that there's many other foundations and NPOs that have managed to donate even to government for PPEs that are necessarily available. But it simply means that we are together as a nation. We must put our hands together and assist each other. So when we are called upon to salvage the situation, we must do so all together, just as much as we can prevent and make sure that we keep people healthy. We do not want a situation where like the situation in India, where we let our guards down.
Yes, true.
So people must remember that even if vaccination is still coming, until we achieve herd immunity, we must continue following the protocols made as the regulations, the wearing of masks, the sanitizing, the washing of hands, keeping the distances, avoiding parties, avoiding sporting events where you have crowded places, including when we go to our religious practices or traditional practices. That is fundamental, because if we don't do that, we are going to find ourselves in trouble, and it's going to be a problem, because this is what has led India to go into a serious difficulty that has occurred. So we are pleading with everyone to at least consider that and make sure that we follow all the rules and the protocols that are outlined for us to do so.
I so agree with you there. It's having to be able to do the necessary and take the necessary precautions so that we don't find ourselves in a third wave, and that's what we're trying to avoid. Because I believe that the new strain is really bad out there, and it's a whole lot worse than the first one. So I think it's for us to be able to be aware of that and be wary of what we're doing as individuals. And I think the responsibility starts with us ourselves to be able to go out there and do the necessary, take the necessary precautionary steps in order to be able to stay safe in some way.
Yeah, certainly. We must say, all of us, it is in our hands to end COVID-19. So while all other health professionals are doing their jobs, all our community members, society in general, let's take responsibility in our actions and prevent a third wave from occurring. Mind you, we are in the season of flu, and it's cold, so it's susceptible that a lot of people might get flus ordinarily. But if we're to get COVID-19 and we get to third wave, it's going to be far worse. That's why it's important to prevent that from happening.
For sure. What is the most important thing that you would like people to know about the nurses? What sort of challenge do you think is the most important that they need to know about?
Well, I think currently the most important challenge is that one of the shortage of nurses. We have a lot of youth that is able, that is committed and willing and aspiring to be nurses. If our government can take them, fund them to be trained as nurses, or if any mechanism can be made so that some of them can be attracted to train as nurses, it will be a solution that is going to be permanent, because in future we'll have adequate nurses to take care of our communities and patients in general. That's why I'm saying that is the most, because although it's a long-term solution, once you put that, you are solving a health crisis in the country. We can then be able to achieve what they call national health insurance, because nurses will then be available in the communities to be able to do demographics where people live, even if it's in the rural area. That's fundamental for us.
What has it meant for you, knowing that you've put yourself out in the front line and you've made so many differences and saved so many lives? Have you reached your purpose?
Well, let me say, a fulfillment of a nurse. It's knowing that what you have done has assisted somebody. So in other words, if you have a patient that gets to a trauma ward, a trauma admission, or a casualty with gunshots, or a trauma case after a car accident, when they look like they are dying, but you get there, you resuscitate them, you make sure you take care of those patients. The minute you see that patient alive and you know that the patient is now stable, that gives you internal fulfillment. Nothing can take away that feeling. When you have to admit a patient that comes to your hospital with, for example, lungs that are full of water, which we call pulmonary edema, and you admit that patient and you quickly intervene and make sure that you dialyze that patient and the patient breathes normally after that, afterwards. You know that this patient is now able to breathe normally because I did something to this patient. When you receive a patient that comes with a wound in a hospital, you dress that wound on a daily basis. The minute that patient walks out of the hospital comfortable with a healed wound, you know that I'm fulfilled because I made a difference in the life of that patient, including when somebody comes in walking or it comes into the hospital unable to even stand as a patient of medical. When that medical patient gets healed and you see the patient walking around and going home out of a hospital a happy person, you know that deep down in my heart, I am very happy. I have managed to change the life of this particular individual. That is the fulfillment that we get as nurses, and we are grateful for the opportunity to do so, because if not us, then who else should do it?
That is so true. What message would you like to leave our listeners with this afternoon?
Well, I want to say to the listeners in general, please note that the nurses of South Africa are capable. They are trained to be well-grounded, organic, intellectual. The nurses of South Africa are well sought out worldwide, because they are known to be experienced and capable. So you must know that in terms of the nursing profession in South Africa, nurses are going to be there for yourselves to take care of you. But let's make sure that we prevent diseases and we stay healthy. Nurses are going to be there when needed. But let's make sure that we help them by not complicating the situation.
Most
That's all.
definitely. We want to thank you so much for joining us this afternoon. And as I said, we once again want to take our hats off, do a standing ovation for you for going out there and so selflessly helping all those people that have been suffering, not just with COVID, but with all the ailments that they come into the hospital with. You've been doing such a phenomenal job. And on behalf of myself and the team, once again, we commend all those frontline workers. We owed to you our gratitude for everything that you go out and doing, and so selflessly every single day. So thank you so much for joining us this afternoon and making us understand and appreciate the nursing environment even more.
Thank you very much, and we appreciate it. Thank you.
And yes, you do have a very good day. Oh, there we go. I was waiting for that. I wanted to shout out for you guys because that's what it means to us. That's how much you mean to us.
Yes. Oh, thank you very much. Thank you very much. We love you, South Africa.
Yeah, most definitely. And you've definitely shown us the Ubuntu, without a doubt. You've shown us the spirit, you've shown us the Ubuntu, and you've given us the hope that we never thought we had. So there we go. Once again, another shout out to you.
Yay!
Thank you very
so
much. You are
Thank
so
you.
welcome, and we wish you nothing but the best going forward. And of course, our gratitude is with you always, and our prayers are with you so that you stay safe. And thank you so much for going out that extra mile and helping all of us and our families and our friends and everybody that we know to get better and live better lives. Thank you so much.
Thank you very much.
You take care of yourself, and thank you for joining us on the show.
Okay, bye.
Bye-bye. Simon Hlungwani, the Democratic Nursing Organization of South Africa's president, definitely giving us some insight and appreciation into how we need to look at our frontline workers and what it's meant during this pandemic. What they've gone through, I think says 1,000 words. We need to understand and appreciate. Talking about appreciation, there's something that I read and I didn't quite get the author's name, but it really stood out for me. It says, let your footprints lead the way to a place where people's value is equal to one another. A place where acceptance is the rule, not the exception, and love is the force that guides everyone and everything. And take care to make your footprints clear enough and deep enough so that those who come after you will find their way to that exquisitely beautiful place. And I think that is absolutely important. That's what it's about. But for those of you, all of us that are fasting, looking forward to this evening, if it is Eid tomorrow, then we wish you, from myself and the team, a blessed day, one with the family, one with love, one with dua, one with loads of blessings. And if not, then definitely for Friday. So from myself and the team, we want to thank you so much for joining us on the spiritual journey during the month of Ramadan to be able to entice you into better spaces, upliftment, empowerment, and of course,